to discuss Dr. Asaf Bitton. He's a primary case physician and executive director of Aradni, sorry about that, labs, and Professor Li Zhang, director of the University of Maryland's Transportation Institute, which collects those numbers we were just talking about. Let me start with you, Professor Zhang. When you look at the numbers, were you surprised? Less social distancing, more moving about? What jumped out at you most?
Well, good afternoon, John. And I think we are all expecting, as you mentioned, some level of reduction in social distancing when these states started partially reopen. But what the results even surprised our team here at the University of Maryland, because we are seeing major reduction in social distancing. Percentage of people staying at home going down by more than 30%, almost overnight following reopening. So we actually wasn't anticipating this much reduction. So it's almost like people were staying at home for too long and they just couldn't wait for a queue to go out.
They just couldn't wait. It's human nature, I guess, but it's also risky in this situation. Dr. Bitton, as we continue the conversation, I just want to put up on the screen a map of the United States just to show the trends right now. If you look at these, where the average of new cases going up in the past week, if you look at that right now, only 15 states are going down from week to week. 28 states are going up. 7 states holding steady. When you see that people are starting to move around, including going into neighboring states, if that state is more open, what worries do you have? What questions do you have?
Well, it's hugely worrisome, John. The fact of the matter is that most states that are reopening have an increase in their daily average number of cases, and they have an increase in their share of positive tests, which suggests that even of the tests that they're not getting enough people tested. And so this increase in case number, this increase in testing positivity rates, and an increase in movement, as the professor's model is showing, all point to a lot of concerning directions for these states to be headed in the wrong direction in terms of the spread of COVID.
And Professor Zhang, you talked about the human nature. I just want to show you Virginia and Illinois. These are states that are not reopened yet, at least not in any significant way. And you say that you see movement. You see the movement in these states. What does that tell you about human nature, about patience, about listening to elected leadership?
Well, even before these partial reopenings actually took place, just conversations and media coverage about partial reopening and protests have also, we've already seen that their impact on reduction in social distancing behavior. What really worried our team the most when we, since we track this data every single day on our platform, data.covid.umd.edu, is really this major increase in number of trips, even in states that have not partially reopened yet, and even worse, people in the states who have not yet reopened are flooding into the states that have reopened. I think that's what Deborah was saying earlier on your show, because that just potentially can bring viruses from locations, current hotspots, to the places that have recently reopened.
And Dr. Bitton, this is from a different data source. This is from SafeGraph, but I just want to show you Boston area and Atlanta area foot traffic. And the gold line at the top of the screen is what it looks like last year. The bottom is what is happening now. You start to see a slight curve up there in the Boston-Cambridge track. You see more of a curve up there in Atlanta, which has reopened to a degree. It's a limited reopening, but has reopened. So you see when something reopens, that line is trying to get back to where it used to be last year versus this year. The Boston line's still down, but bending a little bit. Does that worry you?
It does. Listen, here in Massachusetts, we've been one of the hardest hit states. We've got a huge number of cases, and though case numbers have gone down a little bit, they're in a sort of plateau phase, a long plateau, which I think is an important message to a lot of state leaders, that these curves don't just go up and then magically go down. They often plateau, especially once COVID is deeply enmeshed in your community. So what we know about COVID is that it's spread by human contact and interaction, and we understand as a primary care doctor that humans are social creatures. They want to be connected, they want to be out, they want to be close to other humans. But we know about this condition that social distancing is one of the most effective means to get it under control. And it really worries me as a person who's been practicing in a state that's been so hard hit, that other states that perhaps haven't been so hard hit and might not quite understand the strain and stress it puts on your hospital and healthcare system to have thousands of patients flood in. I'm really worried about the trends that we're seeing in all of these social distancing indexes.
We'll keep an eye on those trends. Dr. Bitton, Professor Zhang, really appreciate your insights today. Thank you very much.